Great. My name is Rachel Freeman. I'm the president of the Sexual Assault Center, and we are proposing to request funding for an implementation grant to advance health equity for rape survivors in Davidson County. You ready for it? Okay, great. Thank you. I'm so excited to be here today to share with you more about what is said in our application. Rape and sexual assault are hard topics to talk about, to hear about, and I really appreciate your willingness to read the application, to consider funding, and to sit and listen to me speak for a few minutes about it. I've been at the center for 17 years now. I am the president as of January, and I have had the great opportunity of being in 4 different roles throughout the organization. And this initiative that we are talking about today is something that has been in the works for 9 years now. So I'm really excited that we're in a place where we can look at actually implementing it. So I'm super excited to share with you some more information. The first thing I wanted to mention to you is that every 98 seconds, somebody is sexually assaulted. Every 98 seconds. So by the time we're done talking, over 10 people will have experienced sexual assault. 1 in every 6 women will experience rape or attempted rape at some point in their lifetime. These numbers are absolutely astounding. However, in Davidson County, we only provide approximately 200 rape exams each year. 200 rape exams each year in Davidson County, yet 1 in 6 women experience rape or attempted rape. So those numbers don't match up. At the Sexual Assault Center, we've done a lot of research over the years to try and figure out how to make services more available and more accessible to survivors, and to figure out why survivors aren't coming forward and why we're not doing the number of rape exams that we should be doing. We've looked at a lot of our sister cities. We've looked at comparable cities in size and population, and we've looked at some of our neighboring cities. Memphis, for example, does about 600 exams per year. They do exams with adults and children, so those numbers can be a little bit skewed. Chattanooga does about 120 to 150 a year, and they are not anywhere close to the size of Nashville, if that gives you an idea. Austin, Texas does about 300 a year, and that's a city very close to Nashville, not in location, but close and very similar to Nashville, and they do about 300 a year. And they set up a non-hospital setting for doing rape exams, and they doubled the number of exams they were providing. So they now do about 600 exams per year. So through the research we've done and through the experience of the Sexual Assault Center, we think the problem is twofold. 1, there is one place to go in Davidson County to get a rape exam, and that place is a hospital emergency room. And 2, you have to know where to go when you need it. And it's a very, very time-sensitive situation. If you're going to seek a rape exam, you have to do it within 96 hours. So you have to know where to go, and you have to know that really quickly. So those are the 2 main reasons we believe we only provide about 200 exams a year. We have an incredibly trained team of nurse practitioners who are able to provide sexual assault forensic exams at Metro General Hospital. They do incredible work with the survivors that come into their doors, but you have to know where to go, and you have to go to the hospital. So after the extensive research we've done, and through partnering with Metro General Hospital and a lot of other organizations, we are proposing to do something different in our community. In March of 2016, so almost exactly 2 years ago, Nashville's mayor convened a task force, a sexual assault task force, and that task force is actually headed by Dr. Bill Paul, the CEO of the health department. And there are a large number of us who sit around the table, and we've been sitting around the table for months every month for the last 2 years. And that team includes representatives from Nashville General Hospital, from Vanderbilt Hospital, from Skyline, from St. Thomas, from colleges and universities, the Sexual Assault Center, of course, from Our Kids Center, from the Office of Family Safety, law enforcement, and the district attorney's office, and a few others. So it's a big group of people, a great multidisciplinary team. And we convened with the main goal to figure out how to provide a more victim-centered, survivor-centered, trauma-informed approach to rape survivors so that they can get rape exams more accessibly and in a more trauma-informed way. So after doing the research and meeting with this committee regularly, the committee recommended that we create in Nashville a non-hospital setting to provide rape exams, and the Sexual Assault Center was chosen as that location. So once that was determined, we were very excited that that was the decision, and we actually looked at Our Kids model. Our Kids provides exams for children in a standalone non-hospital setting. So the idea was to replicate what works so well for children and provide the same for adults. So we embarked on a capital campaign, and we were able to raise all the dollars necessary within 9 months to build the clinic. So we were super excited about that, and we have almost completed construction. Construction will be complete in April or May of this year, and we are now ready to operate, to open, and to implement this project. However, we can't operate and implement this extremely valuable service unless we have the funds to get out and spread the word. I mentioned early on that there are two main reasons why rape survivors aren't getting more exams in our community, and those main reasons are that there's only one place and they don't know about it. So we have got to put resources behind making sure people know where to go when they've been sexually assaulted. That is what we're requesting to do with this funding. We want to be able to implement a system where people know where to go, that they know what to do and they know how to get there. So we are proposing that we continue to work with this incredible multidisciplinary team. We are not going to reinvent the wheel. We are not going to try and do this alone. We're doing a contract with Metro General Hospital, and the nurse practitioner team who provides the exams at the hospital will be traveling to our center. 80 to 90% of people who get sexual assault forensic exams do not need the service of a hospital emergency room. They simply need the rape exam, and they need the emotional support for their mental and emotional well-being and health. So there does not need to be the resources put into a hospital setting to provide the exams. We don't want to replicate the expertise that these team of nurses have, though, so that's why we're proposing that we contract with Metro General. We're actually about to sign the contract, so that is the progress we're making on that. So the nurse practitioners will come to our site and they will provide the exams, and we will have advocates available to be with the survivors. And law enforcement typically come with the survivors because most in our community who are getting the exams reach out to law enforcement first. We expect that that will continue, so this continues to be a multidisciplinary collaboration in that way. But we also know that once there's a non-hospital setting, we expect more walk-ins and people to come without law enforcement. Our hope is that we continue to empower and encourage victims and survivors to report. So that's why that collaboration and partnership is so important, because ultimately what we want to see happen is the victims to get the exams in this trauma-informed, survivor-centered, non-hospital setting, but to also catch the perpetrators. And the more exams are performed, the more evidence is collected, the more prosecutions we'll be able to have. So that's why it's so important to do this in collaboration and in conjunction with all these other players. We can't do this alone. So that's what we're proposing to do through this funding. We know that through the 40 years of work, the 40 years of existence of the Sexual Assault Center, we know how to take care of survivors. We create an incredibly compassionate, nurturing, peaceful environment for survivors to begin their healing journey. And creating this clinic on site is an extension of what we already provide. The construction that is being done and completed right now is within our existing footprint. So it's still a part of who we are. It's still a part of the services we offer. And the uniqueness and the caring, comfort, loving care that we provide is going to still be there. And then we partner with the other people who bring in the expertise, the nurse practitioners and law enforcement, to execute the exams and follow through with the reports. So we are creating that space that we are so good at. And then we are working to inform the community through this funding that this is where you go and this is what you do. If a survivor were to show up at another ER and they weren't able to be served to get the exam there, it's really important that the ER physicians know what to do. And maybe there are medical issues that need to be addressed, so the best place is for them to stay at the hospital. So we're coming up with, in partnership with different hospitals and medical professionals, what is that assessment? What does that look like? What are those questions to ask? When do you know that the survivor should stay at the hospital versus be referred to the Sexual Assault Center? So we need to continue to have those conversations and really embrace communication within all of the professionals who might see a rape survivor, and make sure that everybody has what they need to make the best referral and to get the word out. The more people who know about this, the better our community will be. We can build it, and it can sit there, and we can provide this excellent, wonderful, nurturing environment, but people have to know about it in order for us to make a change. And that's the implementation. That's the healthcare transformation that we expect to see. And what we know will happen is that those emotional and mental health issues that come along with experience of sexual trauma, depression, anxiety, fear, guilt, shame, all of those things that we see survivors experience that we can address and help heal and help on that path of recovery, we still will be able to do those, but we will also be able to provide the medical care that is needed through the medical legal rape exams. So that's what we're proposing, and that's what we're creating, and that is why I'm here today.